what a wonderful session, right? I think first I have to absorb, I think, if something was remaining after, Sangeeta ma'am's session, I think Dr. Sai has not left me any room whatsoever, right? His talk was amazing. In fact, the topic itself, right, for that matter, that connected health in every bed, a necessity more than a choice, I think it can't be put better than that, right? He explained that fatality can be anytime, anywhere to anyone, and that's why we need to be always ready. And that's why, when we are dealing with the healthcare system, why the 21st century system has to be so restricted, that it is just, monitoring is there only in ICUs, right? Why it can't be in every bed which is out there? That is the whole, idea with which Dozee actually started. Before that, let me come back to, little bit and touch upon the current state of healthcare infrastructure in the country. I think somewhat Dr. Sangeeta as well touched upon that, so I would go across this very fast. But we have 5 beds per 10,000, where we are, as in recommended, is close to about 30 beds per 10,000, right? So we are at 1/6 the capacity, and people who are manning them, right, are also lesser, right? Almost 44% of what is recommended. And in fact, that is why, that session of, commending them was very important, because, when there was the time of crisis, these people, they, almost doubled, tripled, 4 times the work they were doing, right, to ensure that, each one of us are here today, right, and we survived, right. I think great work over there. And in fact, that's why, it's such a pleasure that, if we can even, help improving the efficiency of nursing even by 10% as well, I feel that, we are honored that, the kind of work that you do. So, nurse to patient ratio, right, that when it is recommended that it should be somewhere near 1:4 by WHO in India. In private sector, it is somewhere near 1:7 to 1:12 it goes. And in public, somewhere it is 1:10. It even goes to extremes of 1:40 as well, right? And COVID times, it was even worse than that as well at times that we saw. And these nurses are manning close to about 18.75 lakh beds, which we have, right? Remaining of the ICU beds. Of course, ICU beds also, there is 1:1 nursing, which is required over there. But outside that, these 18.75 lakh beds are there, which are manually monitored, right? And therefore, we are ranked pretty low in terms of, healthcare facilities, which is there. I'm not going to again spend a lot of time over there, but manual spot checks, which is only covering 2% of the time of, what patient stays inside a ward, right? It has its own limitations. Many a times the information can be very delayed, because we are checking every 4 to 6 hours according to the protocol. The intervention can be delayed as well, and then because of this, there are detrimental effects. As Dr. Sai also mentioned, sepsis, one of the leading causes of deaths inside wards as well, right? And we are missing that, time and again inside wards. In fact, there were some certain studies, which do explain that mortality inside wards are much worse than even ICUs as well in some of the places. And can we improve that? Answer is yes. So that's where the power of continuous monitoring comes into picture. It improves the nursing efficiency. It reduces human errors, right? At the end of it, for charting, for doing all of these things, right? There is only human that, some error can creep in to the system itself. Early intervention can be done, because you are getting information every second. You are not waiting for that 4 to 6 hours, and after that you are taking one reading over there. You are getting information almost real time over there. The patient experience is much more improved. This is something which I'll cover, and this is more pertaining to contactless continuous patient monitoring, and not just restricted to the continuous monitoring part. And it also reduces cost, right? At the end of it, if we can free up ICUs, we can reduce the average length of stays inside ICU. The nursing can become more efficient. Overall, it leads to a huge cost benefit as well. In fact, that is something which we'll also look up, and which I am waiting for the Satwa report as well on this. Now, talking about, when all of this is so critical and important, right? Why not every bed already has that, right? As indeed, this was the question that, I asked Gaurav, my co-founder, when we founded Dozee almost 7 years back. And we were we are not from healthcare, right? As I come from a race car engineering background. In fact, my job was to monitor health of Formula One cars. So we used sensors, telemetry, everything to actually see how the cars are doing in every second manner so that we can call them early into the pits, or we can optimize the vehicle performance and so on so that we can make the car faster by say 0.1 second to win the race, right? So that is what used to be my job. Finally, I asked Gaurav, right, that what we are doing probably it is killing more people by making cars faster. Why can't we, do and apply this on human health as well, right? And that is what led to Dozee. But more than that, we started writing down what are the different barriers, right? Why us, right? आज हम ही क्यों ये कर सकते हैं? क्यों आज तक किसी ने पहले ये नहीं किया? So we started writing down what are the different problems and why it is not already into every bed. We found that it is linked to high cost. Majority of reason being that a lot of this is also imported, right? 85% of medical devices in India are imported. And these are typically built for systems, for per capita spent of close to $3,000 European standards. And in India, we have $50 per capita spent on healthcare, right? So we are dealing with almost 1/50th the cost, right? And we have to do it. And if that has to be done, it has to be done indigenously. In fact, that is something what Sangeeta ma'am also touched upon. And why can't UPI or Aadhaar, how it has been done over there, the health tech cannot do it for India, right? And that is the first barrier that we saw needs to be solved. The second is the involved operational and technical expertise. So one question I really want to ask all the experts over here, if there was, tremendous amount of money, everything, and if ICU equipments are put across every bed, do you really think that, it is technically possible that, you can hook up electrodes, wires, cuffs to patient? Will that in itself not lead to a lot of inefficiency? Will that not lead to a lot of time going into that itself, right? Continuously leads will be removed, then you have to go and apply them again. So that is what will become the standard in itself, right? So the second barrier we found was that. The third was compromised patient experience. So only because we want to monitor every patient, right? Do you really think that every patient in a ward should be hooked up to wires? Is that not a place where they have come to heal, right? And can we just wrap them around with wires and expect them to heal? Answer is again no, right? And this is why it has not kind of gone ahead so far. I'll go a little faster now. Ill experience with ICU monitors, right? We always think अगर हर बेड में हमने लगा दिया इक्विपमेंट तो ये इतना पे करने वाला है, इतनी ज़्यादा ये अलार्म फटीक क्रिएट करेगा that my job will be hampered in itself. Very valid point and a barrier in itself. Data security. It is going to generate so much data, then what will happen, right, from a data security point of view. Integration with the protocol, right? This is right now not in the protocol, right? So why should I, even care about monitoring continuously and so on? And the last part, that right now, and this is something which probably, I am seeing that change happening right away, with where I started to now, that this was not the highest priority, but after a pandemic, after seeing a gathering like this, I'm pretty convinced that, that is now starting to change. It is becoming a conversation now. And, I want to see that, all of us actually lead this effort towards ensuring that, this becomes the priority on conversation. I'll quickly touch upon what are our learnings so far, right? So we created a system. I'll touch upon that quickly. I'll quickly do a time check. Okay. So our learning so far. So we worked with more than 320 hospitals across country, monitoring close to about 7,500 beds remotely, monitoring about 1,25,000 patients and saving 200,000 nursing hours in this, right? And these are the length and breadth where all we worked, both in public as well as private sector. What we created was, based on all the barriers that we learned, that we have to create a contactless remote patient monitoring and early warning system. And that is what it is, right? It simply just goes under the mattress, doesn't touch the person's body for basic vitals like heart rate, respiration, blood pressure, heart rate variability. Dr. Sai also spoke about that. And other things. At the same time, it is also extensible. So as and when the patient is deteriorating, you can hook up a SpO2 or a temperature probe, or you can do a 12-lead ECG, whatever is required. as and when required. So not required for every patient, that experience, but when required, when the patient is getting critical, you can always attach that. At the same time, the system is connected to the central server, which is monitoring all this data remotely, and thereby giving access, in a handheld device as well as on a central nursing station as well. So that job of, going near the patient just for the sake of collecting vitals is kind of automated and digitized. The entire reporting, which, takes a lot of nursing time, bandwidth as well, that is also automated, right? As in just print out. Why not? There is a single click printout and, the entire vitals report is there for the doctor's round, right? That is something what we do with Dozee. And the most important part of, is the early warning system. The early warning system based on, and this is something again Dr. Sangeeta spoke about, right? Based on these different data and the vitals which are now coming, right? The AI actually does a trend-based analysis. It sees how in minute-to-minute basis the patient vitals are deteriorating, something which might not be even observable for human eye as well. So moment it sees that deterioration, it gives an alert in a timely manner. It provides it to the providers so that, they can take an early intervention. As, experts before me spoke about this topic, but an early intervention can be life-saving, right? More often than not. Today, at least healthcare has reached that space, right? And I am very proud, and it is because of the effort of a lot of people over there. But agar sach mein information time par milta hai, we can save people, right? The intervention part has grown really beautifully. Now, can we use it into prevention? That is the big quest that, we have to ask ourselves. Because when we go into prevention, we can save cost. We can save lives, right? And we can actually, right, give the care which every patient kind of deserves over there. I'm sure you are going to, think about how a contactless system works. We also have a live booth where you can experience them. I'm not going to talk a lot about it, but basically it is based on ballistocardiography. Pooja is going to explain much more details about it in her session. But primarily what it is doing is it is monitoring vibrations, which are being produced in every heartbeat. Every time your mitral valve, your aortic valve are opening and closing, it is creating that tiny little vibrations over there. Every time the diaphragm is expanding and contracting, right, it is creating that vibration. Every time there is a tremor or seizure over there are vibrations. And these vibrations travel down the mattress, which this device is able to capture with very high fidelity, and then, convert it into different biomarkers to monitor all of these vitals. This is an entirely new method of actually, using it. So far, we are used to things like ECG, electrocardiography, and so on. This is called ballistocardiography, right? Ballisto means movement or vibration. Cardiography is study of heart. So that is what this device works on. And now I want to quickly touch upon, some of the success stories of this, right? And play a small video as well. So when we implemented this in a peak COVID time, in that time where nurse to patient ratio are actually at its worst, right? We monitored more than 3,000 patients in IGGMC. This was our first installation, in fact, and that's why the most special as well. And there, using this early warning system and the central command center, we were monitoring close to about 150 beds from that command center that you see in the picture. And these 6 wards, then there was, a direct communication with the nurse which is manning that. And moment there was any kind of, early warning over there, they were alerted, they took a necessary action, like as in changing their ventilator parameters or changing the oxygen therapy or shifting to ICU in a timely manner. We enabled more than 800 successful ICU transfers, right? And for that matter, this was the kind of, impact that we could generate. I'll quickly play a small video about, what, you'll have to see the sound as well, right? So, what this means for a patient, right, when a system like this is implemented.
एक पेशेंट यंग इंजीनियर उन्होंने हमको बताया कि मैं कई रातों तक आईसीयू में सोया नहीं क्योंकि वेंटिलेटर और मॉनिटर्स की आवाज़ आ रही थी और हर पेशेंट का जो मॉनिटर है वो बीप करते रहता है, कुछ ना कुछ साउंड करते रहता है, वेंटिलेटर के अलार्म्स बजते रहते हैं। आईसीयू एक ट्रीटमेंट के लिए तो ठीक है पर पेशेंट की साइकोलॉजी के लिए बहुत पेनफुल है। 17 दिन वेंटिलेटर पे रहने के बाद जब वो इम्प्रूव हो गए, हमने उनको एचडीयू में शिफ्ट किया। नेक्स्ट डे मॉर्निंग में जब उनको एचडीयू में देखने गई तो मैंने उनको बोला कि आज आप ठीक हो, तो वो बोले कि आपको कैसे पता चला कि ठीक है। तो मैंने उनको एक्सप्लेन किया कि आपके बेड के नीचे हमने डोजी नाम की एक मॉनिटरिंग सिस्टम लगाई है, उससे मेरे को पता चला कि कल रात को आप स्टेबल थे और कल रात को आप बहुत अच्छे से सोए हो, क्योंकि डोजी में स्लीप पैटर्न भी पता चलता है। वो बहुत अचंभित हुए। वो वार्ड के लिए वो एक एम्बेसडर बने हमारे लिए। जो भी पेशेंट ठीक से सोता नहीं था या डोजी बेड से बार बार उठ जाता था, वो उनको बताते थे कि आप ठीक से सोइए, ये डोजी बेड है। इस वजह से डॉक्टर को दूर भी पता चल जाता है कि आप ठीक हो। बहुत अच्छा एग्जाम्पल ये रिमोट मॉनिटरिंग सिस्टम हमारे लिए रहा है।
So I think, the reason why I chose to play this video, on, a lot of them I could have played, was that, that one thing that, how one part which I didn't cover in my presentation so far is that, when we actually implement a system like this, which is discreet, silent on the patient bedside, can actually have so much beneficial impact on the patient's psyche as well. They know that they are being monitored, they are being, taken care of. At the same time, they are not going through the entire stress of beeping sounds and so on, right? Which they are typically, it's not a greatest of environment. ICU psychosis is very real. I have been through that myself. And, that is not the most conducive environment. But, when we are talking about creating something, connected health in every bed, that is the kind of, system that we require. That, it also takes into account how patients are healing as well. At the same time, if there is an alert, give a timely intervention, right? Make sure that alert reaches to the provider in time so that, they can save the day over there, right? As they always do. So that's about it. I think, what I also wanted to quickly, in 30 seconds, I'll touch upon is also the fact that, what it means is that, and Dr. Sai also, touched upon that, in fact, Dr. Sangeeta as well, that why just even look at hospital beds or ward beds, right? Why not at home also, right? Finally, patient, when they are going home, still, as in many of them, they are dealing with chronic conditions and so on. They require care over there as well. When they come for a consult, right, how do they know that how they are doing on a day-to-day basis? Right? That's where, this technology is also extensible to home as well. Just put the device under the mattress and it is monitoring all the vitals. And again, creating baselines, creating digital twin model, and then escalating, if there is any kind of red card alert as well. So that's about it from my side. Thanks a lot for organizing.